Hello, and welcome to another Generations Health Education lecture. Excuse me. I hear a little bit of background noise, but maybe that was corrected. Okay, perfect. So thank you. Welcome. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, July 15, and I'm Grisel Rodriguez Morales, Rush Generations Program Director. I'll be your moderator for today's lecture, Bone Health. Before I present to you the wonderful speakers that are joining us today, I'd like to first thank our lecture producer, Hannah Weisman. She's going to help us with the production. She has helped with the production, but it's going to help us manage the chat and other key aspects so that we all can have a great discussion about practical ways to protect your bone health through nutrition, movement, prevention, and early detection. Such an important topic. As always, we are live streaming this lecture via our YouTube channel using the video platform Zoom, which also allow us to host a good number of people that join us with audio only. They join us via phone. We have a great number today. So thank you for joining us. For those of you on YouTube, we ask that you please use the chat function to ask questions or to add to the discussion throughout the lecture. We will make sure that your comments and your questions make it to the presenters. And for those of you listening to the discussion via phone, you will also have an opportunity at the end of the presentation to unmute your audio so that you can ask your questions. We'd like to remind you that all information offered here is for general informational purposes only, and to always seek additional professional advice for situations that are quite specific to you and your needs. Okay, let me introduce first to you Dr. Luisa Milo. After confronting breast cancer, neuropathy, and an osteoporosis diagnosis, Dr. Luisa Milo rejected the premise that physical decline is inevitable. That's what we all should be doing. And rebuilding her health through evidence-based resistance training and moving her bone density out of the osteoporotic range within 8 months. Through her platform, Rebuild with Dr. Luisa Milo, and as a volunteer with the Bone Health and Osteoporosis Foundation, she pairs rigorous information with individualized coaching that helps clients move safely, build strength, and resist frailty. Dr. Milo coaches private clients at Lifetime in New York, teaches dental students on ethical patient communication, and speaks to corporate audiences on rebuilding after disruption. Her work rests on a single conviction, which is when muscle and bone are restored, people regain independence, clarity, and confidence. Thank you so much for joining us. Then after Dr. Milo, we'll hear about our colleague at Rush, Christine Gustafshaw. Always a pleasure to have you, Christine. You have worked in the field of nutrition for over 30 years, and we're delighted every time that you join us. Christine Gustafshaw holds a master's degree in clinical nutrition, is a nutrition consultant, public speaker, and one of only 15 certified specialists in gerontological nutrition in the state of Illinois. Her passion is translating complex nutrition research into usable information and present it to patients, clients, various media outlets, foundations, organizations, and at national conferences. We are so delighted to have you both here. So without further ado, I think I will hand the screen to Dr. Milo.
Thank you, Chriselle. Thank you for having me. I'm delighted to represent Bone Health Osteoporosis Foundation today and share very useful and effective information for your viewers. Next slide. Next slide. Next slide. The agenda for today, in this short time that we have together, because this field is so vast and there's so much to discuss, will be how bones change with age and why it matters, the difference between osteoporosis and osteopenia, and how and why you should know your risk, nutrition, which Kristen will cover in great detail after my discussion with you today, and then movement and everyday lifestyle habits that build strength. Prevention and early detection and innovations that are ongoing today will be our conclusion before Kristen discusses nutrition. Next slide. Osteoporosis is a silent disease in which the body loses too much bone. It loses it too rapidly for the osteoblasts, which are one of the cells within the bone that helps build bone. They cannot keep up. So you either lose too much bone or make too little, or you can have a combination of both. Either way, you have an imbalance, and that imbalance leads to porous and weak bones that can break readily and easily from a fall, or in serious cases, when there's a high risk of fragility fracture, you can obtain a fracture from a minor bump or even a sneeze. Osteopenia, which is the other term you've often heard, is low bone mass, and that is the in-between stage, essentially bone density that is low, lower than normal, but not yet quite in the osteoporotic range. It's a warning sign and an opportunity to act early, although it's not a diagnosis of disease. This disease, as we mentioned, osteoporosis, is common and it's silent. And unfortunately, it's more common than it should be because it's preventable largely with lifestyle habits and changes. And of course, we do have medications to assist in the event for those who need it as well. So, 1 in 2 women who have osteoporosis, and they may not even know they have it, will fracture. And generally, this is in the age category over 50 years old. We do know that 1 in 2 women and 1 in 4 men over the age of 50 will break a bone from low bone mineral density. And fragility fractures are life-altering events that are largely preventable. They do present a large national and global economic burden. Next slide. So the bones change over time, different from what we used to think that they were just a static structure that supported our skeleton as we move about it throughout our lives. But we now know that the osteocyte, the very essence of the bone cell, the mature bone cell, if you will, is the living organ. It's a living cell that communicates readily with your other organs, and it's constantly sensing your environment, its environment, for movement and strain put upon it by your muscles and tendons, which is why exercise, as we'll discuss shortly, is so critically important. Bone is composed primarily of calcium phosphate mineral complexes, collagen, and living bone cells. Again, the osteocyte, osteoblast, which is the builder, and osteoclast, which is sort of like the construction or demolition crew that helps resorb bone. Why do we need remodeling? Because again, bone turns over throughout the course of our lives. We don't have the very same exact skeletal framework as we did when we were born. This skeleton matures and changes and then replaces itself, and that is necessary for healing purposes as well as for growth and development. Children and teenagers replace bone faster than they lose bone, and they generally achieve peak bone mass we all have essentially by mid to late 20s. Old bone cells are replaced through a process called remodeling. And in times of extreme deprivation, for example, if you are nutrient deprived for long periods, sleep deprived for long periods, if you are not exercising and have a more sedentary lifestyle or are sedentary because of an illness or disability, you are at risk for losing bone. Next slide. Risk factors for bone loss and fractures are those that they come in basically 2 categories: those you can change, so the modifiable risks, and those that you cannot change, the non-modifiable risks. So for those that you cannot change, it would be your age, your biological sex, the fact that some medical conditions contribute to bone loss, some medications do as well, your genetics, which are responsible for 40 to 50% of the risk of osteoporosis, and your fracture history. Next slide. Those risk factors that are modifiable that you can change include your body weight. You can improve your muscle mass, which is always the gold, frankly, of your body composition. We do have a place for fat in our composition. We need that for thermoregulation and hormone metabolism. It has a purpose. Muscle, again, is a primary driver of our health, and it's a critical communicator with bone in their crosstalk, as we call it, between muscle and bone that keeps us healthy and thriving and avoiding frailty and fracture. Drinking too much alcohol can increase your risk for osteoporosis and other diseases, smoking and vaping as well. If you are not intaking enough calcium from food and beverages on a daily basis, that is an issue that can increase your risk for fracture. And again, as I mentioned, low physical activity, particularly resistance training, and if you're not intaking enough vitamin D or getting it from outdoor sunlight. Next slide. Nutrition, Kristen will cover in great detail. Again, roughly half of bone is protein, half is calcium phosphate mineral. The calcium is derived from external, meaning sources that you ingest from your environment. So food and beverages are sources of calcium. If you do not take in enough calcium, your body will seek to balance your deficiency by basically borrowing from your bones. So you need the calcium to replenish what you are utilizing and to help you continue to build strong and healthy bones. Next slide. So how do we even know if our bones are at risk? If we are at risk for osteopenia or osteoporosis, essentially the gold standard of testing is still currently the DEXA test. It's a bone mineral density test, and it measures for T-score primarily. It will provide you with a FRAX score, which is a fracture or FRAX plus score. That is a risk of your fracture, fracture risk over the course of your life. It can change and it can be modified, again, with the lifestyle factors that we are discussing today, as well as medications that are available, both anti-resorptive medications and the anabolic agents that are available for those that qualify for them and need them based on doctors' recommendations. So bone mineral density testing is testing the density of the minerals within your bones, like calcium, phosphorus, etc. It's painless. It takes about 15 minutes or less. You can remain generally fully clothed. They'll ask you to take off anything metallic, etc. But it's a very relaxing exam, as you'll see in the photo or the image above. You lie, lie on your back, and the technician is in the room with you because this is a very, very low radiation screening and testing that has less radiation than a coast-to-coast flight. And it's important that we diagnose bone loss and osteoporosis while you have time to do something about it. And it generally is never too late to do something about it. And you want to identify this so that we can prevent the very first fracture from ever happening. Once you have your first fracture, you're more at risk to have your second fracture. So we do want to get ahead of that. And then looking to the left of the screen, the T-score is the bone mineral density score that compares you to healthy aged 30-year-olds. So that is what the T-score represents. The 0 is the 30-year-old roughly peak bone density, peak bone mass score. At age 30, we know that it, as you saw in the previous slide, it increases over your course of your teens, 20s, and then late 20s. You're arriving at peak bone mass, generally speaking. There are exceptions, of course. So the 0 is normal bone. When you get your T-score, if you have a negative score, it places you in the osteopenic range. If you are negative 1.0 or lower, as you get closer to 2.5, you're approaching osteoporosis, and beyond or lower than negative 2.5, you in fact are diagnosed with osteoporosis. And the lower your score, the lower or more into the negative range you go, the more risk for fracture you have. Next slide. So early detection can lower your risk of fracture. This is a QR code if you'd like to scan it to get a sense of how your FRAX score or FRAX plus score is calculated. That taking a photo with your camera, not a photo, but pointing your camera at that QR code will bring you to the link where the FRAX plus calculator resides, and you can see what metrics you need to input to determine your fracture risk. And generally, the institutions that are scanning you are doing this and placing this on your report. The DEXA scan that you just saw in the previous slide, plus your trabecular bone score, measures bone density and bone quality with very low radiation. The trabecular bone score is a new addition to our toolkit, if you will, to test for the strength of your bones, the fracture resistance. So knowing both the outer shell, as you see here on the normal bone circumference in this image, that's the cortical bone that is tested in the DEXA scan. The trabecular bone or cancellous bone is the spongy-like interior, although it's not spongy and soft, but it has these porosities that aid in microarchitecture, gives your bone strength to withstand forces from various directions, which ties into how and why we stimulate through exercise, and we urge you to present forces from different directions, known as vectors, so that your bones can sense this and know, hey, we're needed. We need to stay in place. Let's build. Next slide, please. Everyday habits that protect your bones are pretty commonplace. So there's the usual health recommendations. So I'll review them now. Don't smoke. If you are, try to minimize or go onto a tobacco cessation program, because we know that tobacco speeds bone loss, among other things that destroy collagen. Minimize and also oxygenation to the tissues. Minimize alcohol consumption. Get safe sun and eat well to support vitamin D. Review your medications with your doctor so that you're aware if some may cause drowsiness or dizziness. Again, we're looking to prevent falls in totality, and also falls that could predispose you to a fracture. Get regular vision and hearing exams, and prioritize your sleep and take exercise seriously. Exercise should not be looked at as a frivolous, only if I have time for it, and something that you add on at the end of a long day, week, month, year, and sporadically do it. The more consistent you are, the greater benefits your body gleans, and the more osteoporotic resistance you can remain. Fall-proof your home. Simple things like removing loose rugs, clutter from hallways and walkways, adding grab bars in the bathroom and rails or stairs, anything that could be a risk for a fall. Light hallways and stairs well, using night lights. Wear sturdy non-slip shoes indoors too. I'll add to that to keep your soft tissue moistened so that your hands are not so dry they don't grab the railing or surface that you may, if you're falling, grab onto for help in reducing that fall, and your feet as well. So very, very dry feet can be as slick as ice on a wood floor or carpeting. Practice balance work. Even standing on one foot while you're holding a counter would be a very first step in achieving balance training. Next slide. So moving to build and maintain bone, we know from the Lift More trial that moving in a very specific and monitored, supervised way safely can build bone. So the steps that you can take over the course of your life, or even today and institute tomorrow and the days that follow, is weight-bearing exercise. Working against gravity on your feet signals the bone to stay strong. And as I mentioned before, bone, the osteocyte, particularly within the bone, that mature adult bone cell, it is looking and sensing for biomechanical stimulation and mechanical strain put upon your bones by the muscles and tendons that are attached to it. Bone Health Osteoporosis Foundation suggests about 30 minutes per day, most days of the week, and walking, dancing, stair climbing, or higher impact activities like jogging and even heel dropping if you can handle it. And of course, most individuals, even those that are very frail, can learn to come up on their toes, and drop down onto their heels safely. Muscle strengthening exercises like resistance work with weighted bands and dumbbells, kettlebells, etc., do help build bone and maintain your body weight. Your weight may actually increase as you build muscle because muscle is a denser tissue than fat. So that body recomposition may cause the numbers on the scale when you weigh yourself to increase or stay the same, but you're actually changing your physique and becoming stronger and more fracture resistant. If you have already if you've already had osteoporosis diagnosis or spine fracture, ask a physical therapist what is safe for you. And they'll often recommend that you avoid heavy weighted forward flexion or twisting and heavy, quick end ranged rotations. Next slide. This is an example provided by the Bone Health Osteoporosis Foundation in their Healthy Bones for Life information packet, which again, I invite everyone to visit the website, Bone Health Osteoporosis Foundation. There's a wealth of information there and knowledge and ways to interact and connect as with this community, which is a wonderful community that does tremendous work, advocacy, education, and prevention work. This is a balance exercise. You can utilize these different foot positions to help you achieve balance with different footings. Your feet matter. Again, our contact with the ground, it matters. So the health of your feet and toes matter. Give them space in a supportive shoe and consult a podiatrist or foot and ankle specialist as needed. Next slide. The Live More trial was done in 2018 by Watson and other researchers, including Belinda Beck, and it supported the claim, and this was the hypothesis, and they supported that reversal of osteoporosis with highly supervised axial loading, which is vertical along the axis of your skeleton, your spine, and your long bones. Highly supervised axial load bearing exercises in a professional setting can and does reverse low bone mineral density. It was done five sets, 5 reps, 3 days per week, 30-minute sessions over the course of 8 months, and it was found to reverse the osteopenia and the osteoporosis that they found in that study based on this careful selection of candidates. Next slide. Osteoporosis treatment, it begins once your risk is determined and your status is determined on a DEXA scan. And it's important that you discuss all options with your clinicians. If you are confused or need additional information, this is where the Bone Health Osteoporosis Foundation is very, very helpful in providing free information along all fronts to you with webinars that are run throughout the year. And webinars like this through RustGen are critically important in sharing information with the community at large and making sure that we keep everyone as healthy and as well educated as possible. Knowing your fracture risk can help you decide if you will benefit from a treatment such as those medications, anti-resorptives or osteoanabolics. Next slide. May is Osteoporosis Awareness Month. I'll remind everyone this is a great opportunity to become part of the community and celebrate with your loved ones, family, your coworkers, community at large, and build better bones together. Next slide. Also in October, we have World Osteoporosis Day, another opportunity to be reminded of the importance of keeping your bones healthy and opportunities to join Bone Health Osteoporosis Foundation and be part of the conversation and the quest for preventing frailty at large. Next slide. As I conclude, I want to share these are innovations in detection. There's also been innovations in treatment and the treatment protocols. So there's so much hope and there's so much promise and there's so much real work activity in the world at large going on at this very moment. The trabecular bone score was a beautiful advancement in addition to the tools we have for screening, because the more information we have to gather, the better honed we can be with your diagnosis and your fracture risk, which again, the whole purpose of again is to determine how at risk for fracture are you. And predominantly it's the hip fracture that we are looking to prevent. And that's the most important takeaway is preventing hip fracture is one of the most important aspects of this prevention conversation today and the osteoporosis quest to eradicate frailty and osteoporosis at large, because the hip fracture leads to 30% of individuals that sustain a hip fracture will die within the first year, sadly. The other 40 to 50% will have a no return to their pre-fracture function and will be, in assisted living or living with assistance for the rest of their lives. So this is a life-altering, life-changing diagnosis and occurrence if a fracture occurs. Vertebral fractures also are debilitating, but not with such quite high mortality. AI-assisted screening for low bone mineral density on X-rays and CAT scans is taking place in major medical institutions, one of which being NYU. We were informed in our last interdisciplinary symposium in 2026, hosted by Bone Health Osteoporosis Foundation in DC, that the NYU is screening actively through a system called VirtuOst, OST, VirtuOst, for osteocyte. And they are notifying patients who have low bone mineral density on this quick assessment that is taken opportunistically with the presentation of other X-rays and CAT scans for other reasons, why you may be in the emergency room or hospital. Those opportunities to see your bones and then just flag you as a potential risk and then invite you for for the DEXA scan is where these institutions are engaging using AI tools to help facilitate the process. It's a wonderful addition to the armamentarium of prevention. And the REMS Echolight I'll mention is also an ultrasound technology that has shown promise as an alternative to DEXA scanning for bone assessment. And then finally, in December 2025, the FDA qualified bone mineral density as a validated surrogate endpoint for bone fractures in clinical trials of osteoporosis medications. This is really good news because it helps expedite the advent of medications that work to the marketplace and therefore to the patient as options for treatment. Thank you so very much for having me, and I look forward to answering any questions that you may have. Thank you to Rush Jen, Bone Health Osteoporosis Foundation, for the fantastic work that you do to help all of the individuals that engage with your communities.
Thank you. Thank you. I cannot wait to the Q&A. I think that at this moment, I would like then to invite Christine Gustushaw to speak about the nutrition portion and bridge those points that you made about nutrition.
Excellent. Thank you so much. And thank you, Dr. Milo, for such an informative, amazing presentation. It's always very exciting to work with other professionals with the same types of passion. As they introduced me, they mentioned that I have an extra certification in gerontological nutrition and aging, and we know that bone loss comes with aging. So, you know, I talk on all different types of all different topics over a year's time, but bone health I'm very passionate about because there are so many things that we can do to help our bones and reduce our risk of osteopenia, osteoporosis. And as Dr. Milo's slides presented, there are certainly some things that we can't control, but they wouldn't ask a dietitian to come in if there weren't anything we could control. So I'm going to focus predominantly on the essential nutrients for bone health. And most of us, it's not surprising. I think if we had everybody, type in the chat, what vitamins or minerals do we need for bones? And almost everybody's going to know calcium and vitamin D. But I'm going to also elaborate on other micronutrients that we don't often talk about, that don't usually get the spotlight. and a bit of the why or what they do, and why they're important. Because I'm a firm believer that we are more likely to do something if we know why it's important, right? We kind of like, oh, yes, I'll get to it. I'll get to it. Like exercise. As she mentioned, it's not a luxury. It is something that our body really needs. And I always, probably since I was a child, found it fascinating that astronauts, when they go up in space, they lose bone density. And the primary reason isn't because they're not eating right. They're probably eating better than anybody on the planet. They have very precision nutrition when they're away. But the primary reason they lose the bone is because of the lack of the weight bearing on that bone. And that's what we're trying to stimulate here on Earth is that weight bearing exercise. So all the things that she just said about exercise is just such a critical component, and what your body needs to work at its peak efficiency and to do all those weight bearing exercises is the nutrition and hydration. So calcium, it's basically the primary raw material of the bone, and like the calcium and phosphate. And 99% of your calcium is actually stored in your bones. We use a little bit of it for muscles and nerves and hormones, and our body needs it. But the predominantly it's stored in our bone. And vitamin D increases the calcium absorption from our intestines. So when you bring in calcium, if you don't have enough vitamin D around, you can't actually utilize the calcium. So they really are, like twins. They have to go hand in hand. And vitamin D helps regulate calcium and phosphorus, both that are essential for bone mineralization. Next slide. But in the next few slides, I'm going to talk about some of the least common, potentially, but still extremely critical to make our bones as strong as possible. And they kind of have different properties and different purposes. So for bone maintenance, vitamin K, zinc, magnesium, and manganese are critical. Our vitamin K helps improve calcium balance and promotes that bone mineralization, while vitamin zinc contributes to the bone matrix and the bone synthesis. Magnesium helps keep our bones strong, and deficiencies in magnesium can actually alter and throw off our calcium and vitamin D status. So everybody kind of, all of these nutrients work as a team. And it's just like any group project you ever done. If somebody's not holding their weight or didn't show up, that's going to throw off the quality of the presentation or the project or whatever they're working on. And I'd like you to think about our nutrients like that they need to work in tandem together, and everybody plays that special role. And then manganese. Some of these things you probably may have heard of, but I love talking about the ones that we don't often hear of. And manganese is another that protects cells within the body from oxidative damage, and it helps maintain that bone structure. The structure of phosphorus, uh, phosphorus is that other structural component. So bone is primarily calcium and phosphorus, and copper provides maintenance of that connective tissue piece. But we usually don't hear of these things because they are a bit more prevalent in a lot of different food sources, which I will get to as we continue to talk about our presentation. So when we look at older adults specifically, we are looking at a population that traditionally has not been getting enough calcium and vitamin D. And we'll talk a little bit more about why. But these nutrients, these other micronutrients, are not as commonly deficient in the majority of adult populations. So that's why you don't hear about them as much, but that doesn't minimize how critical they are to keep your bones strong and healthy. Next slide. And then, so we talked about the maintenance and the structure and the building and breakdown. So boron, polyphenols, and potassium are also three other components that are critical for maintaining that bone stability. And I kind of always giggle about boron because we literally never hear about boron unless we're really honing in on something specific, and it helps reduce urinary excretion of calcium and magnesium. So we don't want our body to lose these nutrients, so it helps preserve how much we're keeping around. And then polyphenols are a category of food that help promote bone health by reducing, again, that mineral loss. So it's preserving what we're bringing in and helping it stay in our bodies. And potassium is linked to decreased bone loss and osteoporosis. So we need enough of these nutrients around on a regular basis. Now, a lot of people will say, well, Kristen, do I have to get them all in at the exact same time? No, we need enough storage. We need enough being absorbed in our bodies, but we don't have to take them in every single time. So when you're looking at supplementation, if you're not getting in enough in your food, for, say calcium, and we'll talk about supplements a little bit later, but you may not need the one that costs an exorbitant amount because it has all of these micronutrients. You really need to take a look at and talk to your healthcare provider, dietitian, to see which one of these supplements do I A, need it, and B, which one would be best for me. Next slide. Okay, so let's talk about calcium. So how much do we need? So we need anywhere from about 1,000 to 1,200 milligrams as an adult. And the best absorbable calcium is traditionally from dairy products in our food supply. But a lot of people can't handle dairy products for whatever reason. They don't like it. They were raised, that was a childhood beverage or food, or they may stop having the ability to break down the lactose, which we call lactose intolerance. So there's certainly a lot of different non-dairy calcium sources. But we have to be careful. So notice that these are fortified. So the word here on this slide is fortified, fortified, fortified. That means most of these foods don't naturally or innately have calcium in them. It is supplemented to it. So it's still not like taking a pill form, but it's been added to that product in processing. So rice, soy products, cereals, a lot of cooked dishes might have it. But I want to call out orange juice because since they started fortifying calcium in fortifying orange juice with calcium, I have over the last probably 15, it's maybe 20 years since they've been fortifying it. A lot of people think oranges and orange juice innately has calcium in it, and that's not true. So the marketing was phenomenal about promoting another breakfast beverage that was not milk, and orange juice is the second runner. So it was a great place to put it if you're trying to capture some calcium in the morning. But do not be deceived. Calcium, the orange juice you buy must be fortified with the calcium if you're going to have any in that product. And the same thing with cereals. Next slide. So this is a bit of a wheel that I love to show. It says these foods have about the same amount of calcium as 1 cup of milk. So we kind of used 1 cup of milk as the gold standard in this country because it has about 300 milligrams of calcium. So if you ever see something benchmarked against a cup of milk, you want to think about, okay, that's about 300 milligrams. And remember, we're looking for 1,000 to 1,200 milligrams a day. So a cup of yogurt, a cup of tofu, they're all about equivalent. Mac and cheese, because of the dairy products in it, also 1 cup is about the cup of milk. But look at broccoli. So this is a non-dairy source, about 4 cups of broccoli, 1.5 cups of collard greens, 2 cups of cottage cheese. So as you can see, you can get the equivalent of a cup of milk into your diet, but depending on the food choices you make, you may have to increase the portion sizes that you're consuming to get that same 300 milligrams. Next slide. And the other thing we need to take into consideration is, remember I said dairy calcium is one of the most absorbable calciums that we have access to. While non-dairy calcium is great, the absorbability of the calcium for a lot of different food science reasons that we won't get into today for time. But kale, broccoli, spinach, you can see if we benchmark it to a cup of milk, the absorbability to get that same 300 milligrams would be about 8 cups of spinach, 2.5 cups of broccoli, and a cup of kale for that same amount of milk, while yogurt and cheese are about the same. And oxalic acid prevents the absorption, and that's a molecule that is found in especially spinach. So one of the things to combat and help the absorbability of calcium from our dark green leafies is to add vitamin C or a citrus to it. So a beautiful like spinach salad, maybe with some orange slices or mandarin slices, would be a phenomenal way to enhance your absorbability of the calcium. Next slide. And this is a laundry list. So I'm going to start showing a few laundry lists of things. I don't expect you to all memorize them. There won't be a test at the end, but I just want to really emphasize how many different places you can get calcium and how critical it is to get variety in your diet. Because while these are great sources of calcium, the next few slides, you will see a number of these foods over and over again that also contain some of the other amazing micronutrients that are meant to build your bones strong. So when people kind of think, oh my gosh, now I have to eat all of these foods, not necessarily. You just need to be mindful of picking a couple key foods and incorporating those key foods, getting a list of those key foods on a daily and weekly basis that are called nutrient dense foods. And they promote bone health because they don't only have calcium, they have a myriad of the other micronutrients as well. So we talked about needing 1,000 to 1,200. And if you look at how much some of these products have, the fortification ones kind of hit a home run because they kind of intentionally make sure it's 300. But look at Total Cereal. I don't know if years ago, if any of you remember the Total Cereal commercial where they'd say 1 bowl of Total and they'd have a stack of like 12 different bowls to get all your vitamins and minerals. But calcium, even without the milk, 1 bowl of Total Cereal has 1,000 milligrams. But you can't absorb much more than about 600 at a time. So some of it will be a little wasted, but you can see increasing the variety in your diet will allow you to get different amounts of calcium in different places. So you might eat a cup of, even a quarter cup of almonds would give you 100. And then you're going to have some instant oatmeal or, a tortilla, and it all can add up. Next slide. And then what if you can't take in dairy? That's okay. And I work with people who are allergic to dairy. So it doesn't mean that your bones will suffer if you can't tolerate dairy. It just may mean you have to be a little more mindful about picking nutrients and calculating how much calcium you're getting in on a regular basis. So you can drink 1 cup of milk. And for lactose intolerance, some people can manage a little bit of lactose at a time. So I have a lot of people say, oh, I had a bout of diarrhea after I drink, a milkshake or a big milk-laden meal. And then I say, well, maybe your body can handle a half a cup because lactase is the enzyme that people stop making as they age. And we don't necessarily cold turkey. So you don't wake up one day and you have none. But where you might been able to drink as much milk as you wanted years ago, now maybe you could handle a half a cup. So whether you like it or you just know that you want to get that calcium from dairy, you could try altering the portion size. Some hard cheeses have less lactose in them. Drinking milk with a meal or other foods can help reduce that complication with the lactose. Trying yogurt with active culture because the good bacteria in there also can break down the lactose. So what you're actually digesting has the lactose already broken down. And then, of course, there's a lot of lactose reduced or free products on the market that you can buy. You can buy lactose-free yogurt, lactose-free milks. And then if you would like to buy the regular product, they also make tablets that have the lactic enzyme. So you actually consume the enzyme from an external source to help break down your food. Next slide. And then vitamin D. This is a very sad, pitiful list of foods that have a little bit of vitamin D in it. And you'll notice that calcium and tuna are, I didn't actually put in, it's canned calcium and canned tuna. I have to fix that. And the reason why you get enough calcium there, or even that much, is because there's some bone that's created, that's pulverized in those products. And then the milk is fortified with D in this country. And soy milk may or may not be, but often will have some. So what we're looking for vitamin D is between 6 and 800 as a bare minimum. And the majority of us, we really recommend, staying right below the upper limit of 4,000 to make sure your levels are staying between 30 and 70. So if you have your vitamin D checked, you want that number to be better than 30 and even maybe in the 70 range. And we can't forget the sun. 15 minutes of our body being exposed to sunlight could be enough to maintain your vitamin D stores. However, a lot of us are not going out in the sun without skin protection. We may not be getting enough of our body exposed. We're worried about cancers and skin cancer, so we're putting a lot of sunscreens. Then those are all barriers to that metabolism to create vitamin D in your body. Darker skin as well as aging skin makes less and less vitamin D. And next slide. That's good. You're reading my mind. And vitamin K, another showcase. You may be on a blood thinner that you have to moderate your vitamin K sources. So, this is a reminder how phenomenal vitamin K is for calcium balance and bone mineralization. But if you are somebody who can't eat vitamin K, this is a whole category that's loaded with vitamin K or these dark green leafies. So you may have to watch out how much you consume. But look at kale. And this is all based on 1 cup of asparagus, romaine, broccoli, cabbage, Brussels sprouts, collards, 1 cup of kale, and even 1 cup of romaine has a huge amount of vitamin K for the day. So again, it's just about increasing that variety. If you don't love Brussels sprouts, it has 1 cup has 100, but even eating 1 or 2 of them, eating all of these in moderation can really add up quickly. But kale always blows my mind, how much vitamin K is in that one. Next slide. I'm going to be mindful of time, so I just am going to kind of spotlight some of these things. 3 ounces of oysters has 500% of the zinc you need for the day. 1 cup of yogurt has 20. Pumpkin seeds, you'll see on both sides. Pumpkin seeds are loaded with zinc and magnesium. Almonds, chia seeds, quinoa, black beans, oatmeal, all of these are phenomenal for so many reasons, your whole vascular highway, but predominantly your bones. Next slide. And then manganese, again, that funny one that I was talking about, copper, boron. I'd like you to see that prunes are in all 3 of these. So prunes are a great source of manganese, copper, and boron. And there was a research study that came out that 4 to 5 prunes a day can help postmenopausal women sustain their bone health. So while there's mussels, wheat germs, tofus, I tell people look at food lists like this and start to create menus for the week. When everyone usually says, Kristen, I just don't know what to eat. Well, if you're really thinking about bone health and trying to boost up your bone health, looking at laundry lists of foods like this is a great way to do maybe a chickpea salad, beans, a banana, and prune and orange smoothie, making whole grains along with, a side of sweet potatoes and I don't love oysters, but if you do, you can add those to your meal as well. Next slide. Strontium. Probably haven't heard that since you were in chemistry, even then in high school. Phosphorus and these polyphenols. So polyphenols are that category of antioxidants, a huge amount of antioxidants. And I don't think any of you will probably be as shocked with the polyphenols because we talk about antioxidants so much in our culture right now. Black currants, blueberries, coffee, cherries, strawberries, all our berries, flaxseed, dark chocolate, apples, hazelnut, whole grains. There's loaded with polyphenols that are great for our bone health. And then strontium, it again, these are found kind of peppered in through so many of our foods and whole grains, root leafy vegetables, legumes, and incorporating even just a little bit can help you hit your mark for your bones. Next slide. And I don't know, we're not going to talk too much on calcium deficiency, but if you do need to take a calcium supplement, calcium carbonate is a little harder on your stomach than calcium citrate. You absorb it a little easier, so you may want to do a calcium citrate. Next slide. And there's products on the market like Citracal, Ozcal, Viactive. These are these caramel and chocolate chews. And I kind of want to warn people about these as well as, I think it's the next slide while I have it up here, and Tums. So these products are very easily overeaten, especially this one with somebody with antacids, and the ones that are like chocolates and caramels, if you're really getting that sweet tooth and thinking you're killing two birds with one stone, because too much supplemental calcium, so not the food you can eat as much as you want from your diet, but the supplemental calcium of about over 200 or 2,500 milligrams a day constantly from supplements can lead to soft tissue hardening. And what is one of our most important soft tissues, and that is our heart. So we really want to be mindful of getting as much of these nutrients we can from food and truly only supplementing when we have a deficiency and being very careful not to overlook the fact that something like Tums that's taken for something like indigestion and antacid, that we're not unintentionally throwing off that balance of nutrients and down regulating bone development because we're trying to fix another problem. Next slide. If you have calcium toxicity, so it's that, again, supplemental calcium over 1,200 milligrams a day is usually the threshold, but you could end up with kidney stones, muscle twitching, anxiety, depression. It can even affect your mood and your brain functionalities, confusion, fatigue, your heart rhythms. So this is not something to be taken lightly. Next slide. I think that's the last slide. Okay. I thought we were going to put the other one at the thank you at the end. So I went over a little bit and hopefully we can take some quick questions. So thank you all.
Thank you. Thank you. Excuse me. And then also we'll have Dr. Milo join us as well. It's quite encouraging to hear that, especially for postmenopausal women, that we can build the bone density effectively through by engaging in resistance and impact training and making some adjustments to our diet. But before I ask a couple questions that we have, I'm gonna invite our listeners. We have a good number. If you would like to ask a question, remember you can press *6 to unmute. Let me take a close look to see if anything is unmuting. Okay, anybody? I see one unmute. Go ahead.
Could she repeat about the osteopenia Is that loss of muscle or bone density? I didn't quite understand what she said when she was talking about osteopenia because I have
Osteopenia.
that, and that's
Yeah,
okay.
go
Thank you for
ahead.
that question. It's an important question to review. Osteopenia, that word specifically outlines low bone mineral density. However, we see the concomitant low or adjacent low muscle mass, which is sarcopenia. So the word for the low muscle mass is sarcopenia. The word for low bone mineral density is osteopenia, and we often see them both happening in the same individual, which is why when you correct and stimulate and start to eat and nourish through proper intentional intake of dietary foods that fuel the body and support muscle and bone health, and you train, meaning resistance train, take walks, begin to understand how your body moves, get the help to understand how your body moves and how to move it safely. Once you start to do those things, as well as taking sleep very seriously, protecting your time to sleep, it's your time to recover the cells of your body. And so it's super, super important that you take holistically into account your wellness. To answer your question, osteopenia doesn't define low muscle mass, but we find it together happening in the same individual. Low muscle mass and low bone density often are hand in hand in the same individual.
Thank you.
You're welcome.
Thank you for the question. One question that we have, well, somebody else on mute in case from our YouTube audience. Does a vitamin D test show how much vitamin D is available for calcium absorption?
Do you want me to take that one, doctor? Okay. Yes. So vitamin D is a good indicator of your available vitamin D for your bones. But calcium in your blood is not a good indicator of your bone density, because that's a very confusing thing. So the calcium, remember I said 99% of it is in the bone. It is not in your blood. So when you get a blood test and you check your calcium is one of those tests. It's one of the standard panels on a complete metabolic panel. You'll see calcium, and a lot of people get confused that say, oh, my calcium's fine, my bones must be fine. But that is not the indicator for our bone status. That will tell us if something other metabolic things are being compromised or getting out of balance, but it does not, it's not a good indicator of bones.
For that, we will have to do the DEXA scan that Dr. Milo presented at the beginning. Let's see. One more question. Go ahead.
Can I ask
Want
another
to add something?
question?
Go ahead.
Okay. With the can taking a multiple vitamin will it suffice for all of the things that you listed
So
for
taking a
helping with the bone?
usually a multivitamin doesn't take care of everything, especially if it's a day vitamin, because you can't absorb all the nutrients from that one vitamin at one time. So for example, you need 1,200 to 1,000 milligrams of calcium. If you bought a vitamin that happened to have 1,200 milligrams of calcium, you would at best only be absorbing about 500 of that in that one pill. There are some vitamins that say take a couple throughout the day, and that can help. But if you actually start really reading the vitamin labels, you'll see that they're not 100% of everything you need. And most are not going to have boron or strontium and things like that. So food is first, and that's going to be a catch-all. But I like to remind, especially older adults, because of our gut acidity and some other things going on with metabolism, that a multivitamin might be a nice low-hanging fruit, we like to call it, to say there's very little risk to benefit there. So there's very little risk and potential benefit of hitting some of these other nutrients that may be poor in your diet.
Okay. So you were talking about the vitamin C in the orange juice. So should we be drinking that for it to be saying fortified?
So it's not vitamin C. So oranges are high in vitamin C, but oranges themselves only have a little bit of natural calcium. If you're drinking orange juice to get calcium, then you'd have to drink 1 serving of it. But I'm not a huge proponent of drinking a lot of juice. I'd rather you
Okay.
get that from other sources. But if you do drink orange juice and you're trying to get more calcium, then I would buy the one that has the calcium in it. But they
Okay.
both will have, any of it will have enough vitamin C.
Okay.
The
Thank you.
fortified calcium. Yeah. No, thank you. Okay, in the last couple of minutes, I have two questions that I'm gonna try to answer as one. Because I know that we are talking a lot about weight-bearing exercises. A lot of people are concerned, especially even though Dr. Milo, you were very clear, jogging if your bones can handle it, right? But there's concerns about jumping and running and all of that, and then later on maybe needing a knee replacement. So there's some concerns about how intense the exercise can be, but there's also a question about weight-bearing exercises, if there's a limitation for those that have been diagnosed already with osteopenia.
So it's like everything else, you start where you are. So working with a professional to guide you is a very good idea. And some of the professionals in the space have been certified by BoneFit, which is Bone Health Osteoporosis Foundation's connection to exercise, safe exercise for osteoporotic and osteopenic individuals. I will say that there are other modalities, meaning there are resources available online to guide you. And I would focus on getting medical supervision, number one. So physical therapy, physiatry, exercise, sports, medicine, those exercise oncology is another field that has a say in the health, the musculoskeletal health of individuals undergoing the ravages of, musculoskeletal health. Basically, they're on a decline and they have to fight every day to maintain what they have. And there are ways and supportive elements to do that. Going back to the question, for osteopenia, beginning movement where you are. So listening to your body and learning to listen to your body and being guided appropriately by someone that has the necessary and essential training to know what proper movement patterns are, particularly learning how to squat, hinge, push, pull, carry, even I dare say rotate and anti-rotate. So we don't recommend for high fracture risk individuals or osteoporotic individuals to do fast movements and flex forward under load and so on. So when I say rotate, anti-rotate, it's because life happens to individuals and around individuals on a daily basis. So with the proper supervision and starting at foundational levels of movement, I just mentioned push, pull, hinge, carry, and push, pull, hinge, carry, and squat and deadlift. We have the very essence of in the beginning for proper movement patterns to be then layered upon with strength. So building muscle, nourishing muscle, recovering muscle, moving safely and simply first. Then you build from there. So you can make tremendous strides with osteopenia and even osteoporosis using exercise resistance training, particularly. And I want to go back to the jumping and walking and running and so forth. So they've measured the strain on bones with each of these, and jogging, even though it seems intuitive that it would help bone density, does to some degree, but because of it's not as powerful as controlled impact training, even such as, like I mentioned earlier, the simplest being heel drops. So while you're brushing your teeth or standing at the kitchen sink, you can come up on your toes and drop down on your heels. And you're doing so 30 to 50 times, throughout the day, maybe twice a day, and then gathering 50 to 60 of those heel drops per day. And you're helping to stimulate the bone to remind it to stay in place. It's the simplest thing you can do.
Thank you. Thank you. Okay, well, there's one question, and I hope that, yes, I certainly hope so. If osteopenia can be reversed with treatment or diet, and I'm pretty sure that, with everything that you have said here, including, I guess that's what the Live More trial was all about. And I certainly hope so, because I'm having my second DEXA scan in 2 days. And I was given a whole year to see if there were, with some minor lifestyle changes, then I wouldn't need to take the medication, because something that I didn't want to do. But yes, diet. I have eaten so much broccoli in the last 12 months that I look a little bit green now. But anyway, it's quite encouraging to hear everything that you have said here. All the factors that you mentioned, we can have control over, including the diet, including the movement. And I hope everybody is encouraged to see the lecture once again, since it's recorded now, and share it with others. But any last thoughts that any of you would like to provide, especially around this? I like the concept of remodeling. Hopefully we can remodel and indeed reverse some conditions if possible.
Kristen, do you want to add to that? I certainly do.
Well, I'll let you go first.
Okay, thank you. So really simply, because there's so much we can talk about really for hours, and the education keeps coming and coming, and the research keeps going, which is great. So educate yourselves, number one. Seek information from valid resources, number one. Number two, try to make simple lifestyle changes gradually over time that you can maintain and sustain and be consistent about. There can be a tendency to overwhelm yourself and I have to do everything all at once and everything so perfectly, and really put yourself under a microscope. And while it's helpful to evaluate yourself and, see how you respond to different stimuli, different foods and all of this, yes, but not to make it where it feels daunting and impossible, because it really isn't. And if you are feeling that way, reach out for help, because we collectively as a community are so passionate about spreading awareness, information, advocacy, and changing the way this is perceived and changing the way people proceed.
Yeah. And I would definitely echo that. And I'd like to add, the most important thing is to act today. No doubt you have at least one thing potentially in a cupboard or in the refrigerator that was on this list, but we do all know that you probably could even do some weight-bearing exercises even while you sat here, even if it's a tomato soup can or picking up a water bottle, and you can start right now. Because too often we say, you know what, I'm going to start this on Monday, or I'm going to start this. And when it comes to your bones, you're using them every day. And these types of little strategies we talked about with diet and exercise just need to start being peppered in and infiltrated into every single day life. And I guarantee that you're all doing some of it. We just need to take it up a notch.
Thank you so much. Well, it's been a pleasure, and you're absolutely right. I think we could spend 2 more hours on this topic. Greatly appreciate your time. We want to respect your time, but we are so appreciative of you spending your time with us and providing our Rush Generations members and others with valuable information about this important topic.
Pleasure to be here. Thank you.
Thank
pleasure.
you. And actually, I think we're gonna talk about some of the programs that we offer that may help with this as well, because Fit and Strong is one of those new programs that we have incorporated into our menu of health promotion programs. This is a free workshop that uses flexibility and strength training, as well as aerobic walking, health education, to improve not only your balance, but also your strength. It is a 24-session exercise and education class. And it seems like a lot, but believe me, past participants have said that it goes by really quickly. It's 3 times a week for 8 weeks. And the next workshop will be held in person at our main campus on Mondays, Wednesdays, and Fridays, starting in about a month, August 17th through October 9th, 2:30 p.m. So if you're interested in this, feel free to give us a call. 1-800-757-0202 is the number to call us. Then we have another workshop. This is a 7-week workshop for anyone that is age 18 and older with an ongoing chronic health condition. It's called Take Charge of Your Health. Participants build skills to gain confidence, better manage their health, and lead a more active and fulfilling life. The program includes interactive topics on goal setting, nutrition, physical activity, medication, pain management, effective communication, strategies for working with healthcare professionals. And the next workshop is going to be held at one new wellness center that we are part of in the west side of Chicago. Is the Sankofa Village Wellness Center at 4305 West Madison Street. So please give us a call if you're interested in this one that is going to start also in about a month. As always, we're very interested in learning from you, in hearing from you. You are always welcome to scan that QR code and let us know what are some of the topics that are important to you. What is it that you would like us to, other topics that you would like us to cover, but also how important was this lecture to you. Feel free to always record a video. Our next lecture is going to be on the topic of immune health and aging. It's going to be on a Wednesday, August 5th, also at 1 o'clock. So thank you so much for joining us today. Always, if you have any questions about this lecture, about any of the programs that we discussed, or some of the resources that were offered today, feel free to reach out through our toll-free number, 1-800-757-0202. And you can always follow us on Facebook at Rush Generations. You will be able to easily find it. So look forward to seeing you at the next lecture. Thank you so much for joining.